Just doing a test of the chat function. Can everyone see that? Can someone respond in the chat bar? One-minute warning. Just a reminder, we will record this and provide a link afterwards.
Right, there we go. All right, thank you.
Hello, everyone. We're about to get started. Please don't forget to keep your mics on mute so that we don't have any feedback. And hold all questions until the Q&A portion. And we are ready to begin.
Good afternoon. I'm Charles Evans, Chairman of the Cumberland County Board of Commissioners. On behalf of the entire Board of Commissioners, welcome to the virtual conference on the county's COVID-19 response and assistance. During this pandemic, our media partners have been vital to sharing accurate information on the COVID-19 pandemic. And I want to take the time to personally thank you all for helping us inform our residents. We are approaching the one-year anniversary of the first confirmed cases in Cumberland County. On March 19, 2020, the state notified our health department of 2 confirmed cases. The steadfast work of the subject matter experts you will hear from shortly has not stopped from the moment. These experts will share information on COVID-19 response to help navigate residents through services and opportunities to help them during this crisis. Again, thank you for your invaluable partnership during this pandemic. I would like to now introduce our Cumberland County Manager, Amy Cannon.
Thank you, Mr. Chairman, and thank each of you for participating in our COVID-19 assistance briefing this afternoon. Our goal today is to give an overview of the resources and programs available to assist our residents here in Cumberland County. Health Director Dr. Jennifer Green will discuss vaccination operations. Social Services Director Brenda Jackson will cover information on the food and nutrition benefits and utility assistance available. Community Development Director Dee Taylor will provide us an update on the emergency rental assistance as well as a small business grant recovery program. Questions will be taken after all 3 presentations. Please type your name and media outlet into the chat feature and you'll be called in order. At this time, I'll turn it over to our Public Health Director, Dr. Green.
Thank you, Ms. Cannon, for that introduction. I'm going to share my screen now so you all can see our slide presentation. So as Commissioner Evans alluded to, it's almost a year ago that we received our first case here in Cumberland County. Our response efforts began in the latter part of January of 2020. So we have been at this for more than a year. And since the time of our first case, we've had an additional 24,000 Cumberland County residents that have been impacted by COVID-19. That is a large number, but there's some good news to report. In the last 7 days, we've had 656 new cases. That is fewer than fewer cases in the last 7 days than we've had in the previous 14 days. So our numbers are declining and we've seen some positive trends in our case count. Unfortunately, over the last year, we have lost 274 members of our community. But our numbers are getting better. Our case positivity rate is at 8.9%. We'd like to see that number closer to 5% as recommended by the World Health Organization. But our number, that case positivity rate, the percentage of cases that come back positive has declined over the last several weeks to now be lower than 10%. So that is good news. So I'll start with a bit of information about our where we are in terms of the numbers for our COVID vaccination efforts. In Cumberland County, nearly 35,000 residents have been vaccinated with their first dose. That's approximately 10.3% of our population, 10.4% of our population. And in addition, 23,255 residents have also received their second dose and are fully vaccinated. So those are good numbers. We are making a strong effort to get our residents vaccinated. We do continue to see some disparities by race ethnicity. Although I'm proud of the work that we've done in Cumberland County, our disparities are sometimes smaller than the disparities at the state level. 1 in 3 residents that have been vaccinated are African American or Black. And in addition to that, we see approximately 5% of our population or of those that have received their vaccinations are Asian or Pacific Islander. Last week it was announced from a statewide or national report that North Carolina was first in vaccinating residents that are over the age of 65. In Cumberland County, 37% of our vaccines have gone into the arms of those that are between the ages of 65 to 74, and another 25% of our vaccines have gone into those arms of those that are age 75 and above. Over the weekend, we heard good news from the Centers for Disease Control and the U.S. Food and Drug Administration about a new vaccine that is going to be available soon. That is the Johnson & Johnson vaccine. Over the weekend, they issued an emergency use authorization for this Johnson & Johnson vaccine. It is similar to our Moderna and Pfizer vaccines. It went through the same review process and was determined to be effective at preventing COVID without any major safety concerns that we're aware of. That means we now have a third vaccine that is safe and effective that we can roll out to the public. The vaccine was found to be 67% effective in preventing moderate or severe, moderate to severe or critical COVID-19 after being fully vaccinated, and 77% effective in preventing severe or critical COVID-19 cases after being fully vaccinated. This is our first single dose vaccine that is available to the public. So that comes with it a lot of reducing some of those barriers to the logistics, including just having to come once to a vaccination site. It also doesn't require some of those ultra cold storage that we see with Pfizer and Moderna. And so it makes the logistics of rolling out that vaccine a little bit easier. So we're excited to see what that's going to look like in North Carolina, and specifically what that will look like in Cumberland County in the coming weeks. So we want to remind our Cumberland County residents that you do have a spot to take your vaccine, and it is important that you find your spot and you take your shot. We are currently vaccinating individuals in groups 1, 2, and a portion of group 3. That's our healthcare workers, our long-term care staff and residents, our older adults, anyone over the age of 65, and a portion of our frontline essential workers, specifically our child care and our school workers that are working in pre-K through 12 settings, and those that are working in child care settings as well. So those individuals are currently eligible. If you are still if you still need to determine when it is your turn to get your spot and to take your shot, you can go to the State Health Department website and find your spot, or you can visit the Cumberland County website as well, and we'll have that available on the slides. Currently, and this is our current vaccination schedule in Cumberland County for the health department, we commit Tuesdays to doing our second doses. So Tuesdays are our second dose only clinics, and we do that by appointment. So if you still need your second dose, you can go online to www.co.cumberland.nc.us to schedule your second dose appointment. Wednesdays are first doses and second doses. Our second doses are in the morning, and then we take care of all those first doses for eligible individuals in the afternoon. Appointments only from 9 a.m. to 5 p.m. On Fridays, we do appointments from 9 a.m. to 3 p.m. for first doses. And then our standby lane for eligible individuals is from 3 to 5 p.m. on Fridays. We encourage everyone to stay tuned to Cumberland alerts and to our social media and to our website, because that's where we'll have up-to-minute information about what is happening at our vaccine sites, if we have any available doses, or if we are changing groups, and when we are moving from phase to phase. And as we mentioned, you can now schedule your own appointment online. You no longer need to wait for or request an appointment. You can schedule your own appointment online. And certainly if you need assistance doing that, we have a call center set up. And many thanks to our library staff and to the National Guard who helped to staff that call center. And that phone number is 910-678-7657, 910-678-7657 for assistance and scheduling your vaccine appointment for those that are eligible. It's been critical that we are intentional about our efforts to reach historically marginalized communities. And we have been intentional from the very beginning about making sure that we are doing that. And we have more work and more opportunities to do that coming forth. Our public information office produced videos with community voices about getting vaccinated and why it was important to them as an individual citizen, as a leader in our community, to get vaccinated. And you can find those videos on our social media pages. In addition, several weeks ago, we launched our transportation initiative. So through our community transportation program, individuals can now request assistance to come to the vaccine site. So when you go online to schedule your appointment, or when you call for an appointment, you are automatically asked if you need assistance to the transportation site. We don't want that to be a barrier for individuals. So the Cumberland County Community Transportation Program works with us to coordinate transportation for individuals out to the vaccine site at the Crown so that we can make sure that all those that want a vaccine have opportunity to do that. In addition, we have rolled out several off-site clinics that are separate from the Crown Coliseum to make sure that we are vaccinating those that are some of the most vulnerable in our community. And that's those that are in long-term care and other senior living facilities, including a few senior living facilities that have a majority of 65 and 75 and up population in their care, along with some behavioral health facilities, including those with developmental disabilities. In addition, we have partnered with several agencies that specifically serve historically marginalized populations to help us fill our appointment slots so that they can help us identify community members to do that. One example is our Vision Resource Center. We are so pleased to partner with them, individuals that are either completely visually impaired or partially visually impaired and may have challenges navigating a vaccination site. We partnered with them to make sure that those individuals who are eligible have the opportunity to get vaccinated. In a similar vein, we also partnered with the Salvation Army, Alliance Behavioral Health, and Operation Inasmuch to help us to identify those individuals that were homeless or unsheltered, and to get them that were at the time eligible over the age of 65 to get out to our vaccination site, coordinated transportation with them to vaccination site so that they could get vaccinated. So that is a partnership that we're proud of and very wanting to make sure that we build upon that. In addition, those that come to our vaccination site are also connected with mental health resources, and many thanks to Alliance Health for providing material when you get your vaccine. In addition, you get an opportunity to connect to the Hope for NC hotline, so that you walk away with information about your own mental health or those that are in the vehicle with you, health resources that are critical in our community. So I'll pause there and I will turn it over to our next speaker.
Hey, good afternoon, everyone. Kristen, I'll make sure everybody can hear me and see the screen.
Yes, ma'am.
Okay. Good afternoon, everyone, and thank you, Dr. Green, for all that you and public health are doing and those that are supporting the efforts in vaccination. And I thank all of our media guests with us this afternoon to help share information about services to our citizens. I'm Brenda Jackson, Director of Cumberland County Social Services, and want to just share with you just a little information regarding some of the programs at Social Services related to COVID-19. Before I get into that, let me just say that we are continuing to provide all of our normal services, our food and nutrition, which most people know as food stamps, our Medicaid, child care, Work First, all of those eligibility-based programs. We provide those services via now mail, virtual, telephone, fax, those kinds of things. We haven't seen large spikes in recent months. When COVID first hit in early 2020, we saw our food stamp numbers and our Medicaid numbers spike significantly. But over the last 3 or 4 months, those numbers have leveled off. We're serving about 34,000, a little over 34,000 households for the food stamp program. A year ago, we were serving about 32,000. We're serving about 79,000 Medicaid recipients. Last year, or prior to COVID, we were serving somewhere between 84 and 86,000 residents. But we have seen those numbers level off. What we want to share with you this afternoon is services related to COVID-19. One of the things you're going to hear a lot about over the next few weeks is pandemic EBT. This is food assistance for school-aged children. Children must attend, or students must attend, a private, public, or charter school and receive free or reduced lunch for the current school year of 2021. They have to also be in some type of fully remote learning, meaning all virtual, or some type of hybrid, meaning a combination of virtual or in-person during the month that they're eligible for benefits. According to the school, I did talk with them this week. Currently, they have a little over 36,000 students that qualify for pandemic EBT. The allotment is based on the mode in which the child is attending school. If the child is fully remote, the maximum amount is $115. If there's a combination of virtual or in-person, the state has a real complicated formula that they use based on the number of school days and the number of days that the child may be either in virtual or in person. And so I'm not able to tell you what that amount might be, but the maximum amount that any child can receive is $115.94. And that's per student that receives free or reduced lunch. What's really, really important that any questions that you have about free or reduced lunch or whether or not a child qualifies, we recommend that the parent or the guardian contact the child's school. Again, we've seen pretty much, we hope that individuals who don't have a student in school and still need that kind of assistance, food assistance, that they will apply for our regular food and nutrition program. And at the end of the presentation, I'll share with you all of the contact information. With the regular food stamp program, the only difference that's really happened is everyone is receiving the maximum allotment that if they weren't already receiving it. So say, for instance, based on income, a citizen only qualified for $200 because of income. But if they're no longer working now, everybody's getting the maximum amount. So maybe the maximum amount for that household was $400, but they were only given $200 because of their income. Now they would get that full allotment. The other thing that has happened with our regular food stamp program is an increase of 15% of all benefits, and that will expire June 30th, 2021. The other thing that's new that will stay, that was created during COVID and because of COVID, but will stay as a long-term program, is the ability for citizens to use their benefits online or through delivery. And that's through Amazon, Food Line, Walmart, Carly C's, and the state is constantly adding new vendors that will provide online and delivery services. And so again, pandemic EBT, that will last until June, the end of the school year. If for some reason that's extended, then of course the state and federal government will extend pandemic EBT into the next school year if that's approved. Next is our Energy Assistance Program. I'm going to start with the Crisis Intervention Program because that's a program to address immediate needs. It's a year-round program. It starts every year in July. We get an annual allocation, and we provide this services as long as we have availability of funds. Individuals must be at danger of experiencing a heat or cooling crisis. The service does not cover water, sewage, or trash costs. The maximum benefit is $600 per year. To date, we have processed over 5,000 applications for that program, and over 4,000 have been approved. The process for that, if an individual is eligible, then we, within 48 hours, will contact the energy company. It goes directly to the utility provider and pledge payment to prevent cutoff or to reconnect services. What's different since COVID-19 with the Energy Assistance Program, and let me back up, I've been doing this about 34 years and that program hadn't changed much in 34 years in terms of how it operates. What's different since COVID is applicants are no longer required to have a disconnect notice. So they can have a past due or a final notice bill, and that's very critical and important because if citizens are able to apply for that earlier, you have a lower risk of disconnect. Citizens can apply by phone, mail, email, or fax. Applications can be dropped in our drop box. We have 2 located on the Hillsborough Street side of the building. We put signs out so that citizens can easily find those drop boxes. And again, they can mail, they can email, they can also fax, and they can also call us. What's also new is an interview is required, but the regulations related to in-person interview has been lifted, and so we can do those interviews telephone or virtually. What's very important to note and very, very critical is citizens, when they apply for this program, that it's important that they include their contact phone number, and if they have an email address, to include that. We cannot conduct the telephone interview or the virtual interview if we can't reach the citizen. So it's very, very, very important that they put their contact number and email address. We ask for both, just in case for some reason the phone is not operating or some reason we can't get up with you, we have at least an alternative way of getting up with you through your email address. Again, we will not and cannot obligate any assistance if we cannot eliminate the crisis. Remember, SIP will not pay for water, sewage, or trash costs, and so therefore citizens would have to pay and take care of those expenses before we can obligate any SIP benefits. Also, if the citizens' need exceeds the $600, so for instance, they have a $700 bill, they would have to obligate that $100 in order for us to obligate the SIP benefits. For those situations, we will refer citizens to different community agencies if they're not able to come up with those resources themselves. But unfortunately, these are state and federal policies, and here in Cumberland County, we don't have a lot of flexibility in making exceptions to these regulations. And so unfortunately, citizens often have to come up with those items that are not covered by SIP. And again, for this program, we process applications within 48 hours. And if the citizen is eligible, we call the utility company and pledge those benefits. And that's our crisis intervention program. Our next program is our low income energy assistance program. We call it the LEAP program. It's a one-time vendor payment to offset annual heating expenses. This is a seasonal in the sense that it operates every December 1st through March 31st. And it's also based on availability of funds. Application processing is up to 10 days. To date, we have taken over 4,600 applications and have approved over 4,000. The benefits for the LEAP program range from $300 to $500, depending on the household size, the income level, and the source of heating. The source of heating could be utilities, wood, gas, oil, those types of expenses. We approve payments directly to the energy provider, and it could take up to 6 to 8 weeks from the time of the approval until the benefits have been credited to the citizen's account. You might say, why does that take so long? Well, we want to make sure, first of all, every application has to be keyed into the system. We QA those applications. We're talking about millions of dollars that we authorize in benefits. We have to batch those items. So if we take 100 applications today and 50 of those been approved for PWC, another 30 have been approved for South River, then we may have wood vendors and oil vendors and Piedmont natural gas. All of those applications have to be sorted, keyed, sorted, batched, quality assurance. Then they go through our DSS finance department, to the county finance, then over to the utility company, and then they have to match all of those applications with the individual's account, and that just takes a process. So we let citizens know it takes 6 to 8 weeks. If citizens have an immediate crisis, they need to apply for the crisis intervention program. But the first thing they need to do is also contact their utility company and let them know that they're having a crisis, or that they've been approved for LEAP, or they're applying for the SIP program, and try to make an arrangement. With that said, LEAP will not necessarily prevent disruption of termination of services. What's new and different in the LEAP program is citizens that received LEAP benefits last year, which would have been for December 1, 2019 to March 31st, 2020, those citizens will automatically approve for payments and for processing to be credited to their accounts. Other citizens who did not receive during that time period can apply, and they again can apply by phone, mail, email, fax, Dropbox, similar to the SIP program. They are not required to have a face-to-face interview. That's new. And we can do those applications by interviews by telephone and virtual. Again, just like the SIP program, it's very, very important that the citizen includes their contact information, telephone number, email address, so we can conduct that required interview. Again, if citizens have immediate needs, utilities are being disrupted or terminated, again, it's very, very important that they contact their energy provider, apply for the SIP program, or seek other community resources. With that said, this is more information. We have a pretty detailed contact list, all the ways that citizens can call, email, fax. All of that information is on our website. Anyone has questions about any type of assistance, DHHS has a wonderful website, and that's also linked. We have that link on our website as well for all kinds of assistance. We have our phone number, 910-323-1540, our address. I will just remind everyone, it's a little bit deceiving. We're at a Ramsey Street address, but the front of the building faces Hillsborough Street. So the drop boxes that I talked about are on the north and south entrance of the Hillsborough Street side of the building. And we have the fax numbers and then other links and information to share with you and to our citizens regarding how to access services and any questions they may have about these benefits. At this point, I will turn it over to our next speaker.
Okay, good afternoon, everyone. I would like to provide you with a brief overview of the Emergency Rental Assistance Program and other similar programs that are currently being implemented in our community to meet the needs of those residents who are impacted by the current pandemic crisis. So approximately 426 cities, counties, and towns met the population threshold to receive allocation made possible through the Department of Treasury to provide emergency rental assistance. 18 local governments in North Carolina were eligible, as well as the state, to receive this allocation. Cumberland County received approximately $3.7 million, and the city of Fayetteville received approximately $6.4 million. And so the city and the county felt that it would be more beneficial to the community if we implemented the Emergency Rental Assistance Program jointly. And so the city and the county issued a request for proposal to seek a qualified firm to administer the program. The RFP was released on February 10th, and the submission deadline for the proposal was just this past Friday on February 26th. We're hoping to execute a contract with the selected firm by April, especially since we have such a short time frame to expend the funding. So the Emergency Rental Assistance Program will provide financial assistance to cover things like rental payments, rental arrears. It will also cover utilities and home energy costs, as well as utilities in arrears. If a household has been permanently or temporarily displaced, it will cover relocation expenses, as well as rental fees, accrued late fees, and also cover internet service because that is connected to housing. Many households use this internet service for distance learning and telework. What it does not cover is mortgage assistance. So if you are a homeowner, you will not be eligible for assistance through this program. So let's talk about who would be eligible for this program. Any household with an income at or below 80% of the area median income will qualify, and I'll give you an example in a moment. Households that qualify for unemployment benefits or a reduction in household income or experience any other financial hardship, and those who are just experiencing a housing instability may qualify for this program. Priorities will be given to those who have an income that is at or below 50% of the area median income and have been unemployed for at least 90 days. So let me give you an example of a household that will meet the income eligibility criteria. So let's say if there's a household with 4 persons in the dwelling unit, their income cannot exceed $46,500 a year. If their income is at or below $33,100, then they meet the 50% AMI, and they will be given priority over all those who are above the 50% AMI, but just below 80% AMI. And so I mentioned the emergency rental assistance program that would be forthcoming. And you heard Ms. Jackson provide you with information on the programs that are being implemented through DSS. Cumberland County also receives a Community Development Block Grant, or CDBG funds, on an annual basis as an entitlement. And last year, when the pandemic crisis hit our community, the Cumberland County did receive additional CDBG funds made possible through the U.S. Department of Housing and Urban Development to address the needs of our community that was impacted by this crisis. And so community development used the additional funding and allocated it to activities mainly to provide public services such as rental assistance and for economic development activities. We partnered with nonprofits in the community to provide rental assistance and mortgage assistance, which is unlike the emergency rental assistance program, and utility assistance. Through this program, they still have to meet the income eligibility guideline, which is their income do have to still fall within 80% of the area median income. And most of the referrals have been coming through our community-wide coordinated entry system, which is the number that you see before you. And some have contacted the agencies directly, or they were referred through the 211 system. The CDBG additional funding was also allocated to assist small businesses in our community that was impacted by the pandemic. This program was established by our department just last year. The application process opened up in May of 2020, and it is for for-profit businesses with up to 10 employees. Their businesses must be located in Cumberland County, outside the city limits of Fayetteville. And the main focus of this program, they also must create or retain jobs for low to moderate income employees. Grants are available for up to $10,000. And so it's not in the form of a loan, but a grant, and they don't have to worry about paying this funding back. The additional requirements on eligibility and further requirements are available through the application guideline that's on the Cumberland County Community Development website that you see here. And if you need additional information on the emergency rental assistance program, you can actually obtain further guidance on the further guidelines and additional information on the allocations through the U.S. Treasury Department website that you see presented before you. And I will, that will end my presentation. I'll turn it over to Christian. Thank you.
All right, thank you. At this time, we will entertain questions remember to please type your name and affiliate in the text box, and we will introduce you. Does anyone have any questions for our panel or Miss Amy Cannon or Chairman Evans?
I do, but I don't see where to type my name.
Uh-oh, sorry. It's the, if you go up to the top, the chat bubble, but you can go ahead and introduce yourself.
Yeah, I'm Gilbert Bays. I have a couple quick questions for Dr. Green. Am I okay to ask the questions?
Yes, go ahead, sir.
Yeah, so Dr. Green, you're moving forward with Group 3, which includes teachers and grocery store workers and a lot of essential workers. Congratulations on doing that, because you're moving ahead of some of the other larger counties and moving to this next group. Are you concerned, or how are you going to verify these individuals actually work in those professions, or is this just an honor system?
Sorry about that. So we are going to move into that group, that larger Group 3, when permitted to do so by the state health department. So when we assess eligibility in advance, so when individuals go online to schedule their appointment, they will self-attest to their status, whether they're a grocery store worker or a teacher or they work in a restaurant. They will be able to select the option about what industry they work in. And then when we get on site, and then they'll be able to schedule their appointment. And we ask that individuals are, of course, honest about that. And then when they get on site, we will confirm their eligibility by asking similar screening questions as to what is on our website. Where do you work and in what setting do you work in? And those are going to be consistent with the eligibility criteria that are listed on the state health department website in the Find My Group finder.
And so you've been very successful in vaccinating a lot of folks, to the extent that we have folks coming from South Carolina, from other counties coming in. Are you fearful that other grocery store workers or teachers will come from other counties to get their shots here in Cumberland County?
So at this time, we're vaccinating regardless of county of residency. We have considered in last week, for a short period of time, we limited appointments for those that were Cumberland, that lived in Cumberland County or worked in Cumberland County. And then when we had more available doses, we opened those appointment slots back up again. So we're going to monitor the availability of appointments so that we make sure that our residents that are in Cumberland County, or either whether they live here or work here or seek medical care here, have opportunities to get vaccinated.
And this new group opens up a large potential pot of folks who are going to be eligible for the vaccine. Do you have any idea what that number is here in Cumberland County?
I don't have that number off the top of my head. It's a little bit harder to kind of hone down specifically on what that number is. We know that there are, as you said, it's a pretty large group of first responders, of grocery store workers. And so I don't have that exact number off the top of my head, but it's certainly larger than any of the other groups that we've had come forth already.
And lastly, for me, I've talked to some grocery store workers today who are excited about being able to get the shot. What is the process for them in order to do so?
Yes, so we want to make the process as simple as possible. They can make an appointment in two ways. They can go online and schedule their own appointment. And again, going through that brief screening form, it's just a few questions. And at the same time, if they need transportation assistance, they can select that and we'll arrange transportation with them. And then when they get to the vaccine site, they will receive it, or prior to coming to the vaccine site, they'll get an appointment confirmation via email. And then when they arrive to the vaccine site, they'll be able to produce that email confirmation if they have an email address. They'll get in line, and we do appointments and appointment blocks. So for example, if you are a teacher or a daycare worker or a grocery store worker and you select that 3 to 5 time block, but you get off at 4 o'clock, you can still come anytime between that in your time block. You come to the vaccine site, you remain in your vehicle. Our staff will check you in, and then once you are checked in, you will drive through our building and you'll roll down your window, and our staff will ask you to complete a health assessment to make sure that you're safe and healthy enough to get the vaccine that day. And then once you complete that process, you'll roll down your window one more time for us. Our nurse will give you some information about the vaccine you're receiving, including safety information and where to report any side effects. You'll get, we'll stick you, and then you'll drive out into our waiting area where we'll ask that you wait at least 15 minutes, and that parking lot is monitored by health care professionals, so we make sure that there are no immediate adverse side effects. And then, of course, you're going to come back to us in 3 or 4 weeks, depending on what type of vaccine that you get.
And are you getting J&J or just Moderna and Pfizer?
We have not yet received notice that we are receiving the Johnson & Johnson vaccine. To my knowledge, in North Carolina, those are going to some of the larger events first until we can get more supply of that Johnson & Johnson vaccine. So not yet, but we'll be ready if we do get it.
And my last real question, are you going to make any attempt to go out into the community like you've done at E.E. Smith to make these shots, additional shots available to the new groups as well?
So we are trying just a couple of different things. So for example, when it's time for the individuals that are unsheltered to come to get vaccinated, we'll do a clinic for those individuals, especially those that are having trouble getting to the vaccine site. And we'll work with Ms. Taylor's team and our Salvation Army in our Operation Inasmuch and some of our homeless serving agencies to plan that. So we're in the planning process of that right now. And then, of course, when individuals are not able to get to the Crown, we have that transportation piece available for them as well.
Thank you very much.
Thank you.
Thank you. We're going to go with Kayla Strayer from CBS 17.
Hi everyone, happy Monday. My question was also about the Johnson & Johnson, if you know if we're going to get doses here. And then if you could just touch on, Dr. Green, the effectiveness of Johnson & Johnson. Like, would you recommend people get whichever vaccine they have access to first, or would you recommend they hold out for one over the other?
So we don't yet know when and if we're going to get the Johnson & Johnson vaccine. We'll get that. We get our allocations from the state. So if they inform us that we are getting that J&J, then we'll know. We don't have one recommendation over the other at this time. The effectiveness of the Johnson & Johnson vaccine is about 66 or 67% effective against the moderate or moderate cases of COVID to severe, and then in the 70 percentile for those that are severe cases of COVID-19 or severe or critical cases. And so at this time, we're really recommending that people get vaccinated. We want you to be able to get your shot when it's available. And then, of course, you want to consult with your healthcare provider when you do that. So some healthcare providers may, depending on your health history, may recommend one or the other, but that's not something that we'll be able to answer for each specific person. They really need to consult with the healthcare provider on that.
Thank you.
Next up, we have Steve Devane from the Fayetteville Observer.
Hey, thanks a lot. I appreciate it. I've got two questions, one for Dr. Green and then one for Ms. Jackson. Dr. Green, I think I've heard you talk before about there are some issues with folks who were, I think you called it appointment shopping, like they were getting appointments at several places, and then they would just take the one that they got first, and then they would show up for the other ones. And I've also heard in some other counties, it's kind of related, that the counties will kind of develop a waiting list of folks who might not even be eligible, but they've already gotten the vaccines out and the vaccines are going to go to waste. So they will call people on that list. Are y'all doing something similar to that?
So we encourage strongly, if you have vaccine appointments in multiple locations, If you please cancel the appointments where you're not showing up or where you're not going to actually get your vaccine. We are seeing that where people will make vaccine appointments or get on multiple wait lists. And we strongly encourage you, if you are not getting that vaccine with us or the hospital or another county health department, please cancel that appointment so that you can, so that somebody else can have that space, because we're holding that, we have a dose with your name on it. In Cumberland County is when you get your email confirmation, you can cancel it in that same email with that confirmation. You can use that email to cancel your appointment or to reschedule it. And then in the same way, you can, if you need to, or you can call our phone line and we will cancel that appointment for you if you don't have access to email. So both options are available. And then I think the second part of that question was about the waiting list. We had a wait list of individuals that we would kind of fill in for kind of missed or appointments for the next day. But right now, because we have a rolling appointment schedule, essentially, because our appointments are always available and you can schedule yourself, it allows us to fill in those missed visits. So if we have 100 appointments available today and somebody cancels, then somebody else can go online and schedule that appointment in their slot. Typically, at the end of the day, when we have appointments available, we just have, when we have missed doses or doses left at the end of the day, it is typically just a few doses, 1, 2, maybe 3 doses at the end of the day. So it's a very minimal number. What typically happens is that we already have people in line that are not eligible, that are already said, hey, I've heard that you may have a dose or 2 left at the end of the day. They're already in line to get that vaccine, and they're just sort of waiting off to the side to see if we have any doses. So we haven't maintained a really long wait list because it truly is just a few doses at the end of the day.
Okay, but that's not something you would encourage somebody to do, I'm assuming, to come hang out and hope that there's one. If they're not eligible, it's probably not a good idea.
Correct. We don't want you to come hang out with us. We'd love to see you, but probably not at 6 a.m. And hang out with us all day to wait to see if there's a vaccine available. We typically won't know that until the very end of the day, in the last, just a little bit of time at the end of the day. And so if when we have people come to the vaccine site and we determine that they're not eligible, we'll tell them, hey, you might want to come back at the end of the day to see if we have a dose. But we don't encourage long lines of people to come to the vaccine site and just wait for hours on end because that can create a lot of other challenges.
Okay, thanks. And Ms. Jackson, the thing I wanted to ask you, you mentioned that if people aren't, if they have an immediate need, they should apply for the CIS, I guess it is, I think. But if they aren't, and you said the other one takes like 6 to 8 weeks. So my question is, do the utilities generally work with folks or work with you or work with y'all? Do y'all kind of, like if somebody is eligible for the LEAP, I think you called it, and not eligible for the immediate service, and they know it's going to take 6 to 8 weeks, y'all kind of, is that generally worked out, or can that become an issue?
Okay. So let's separate it. So for the LEAP program, that's a one-time seasonal program. Like you said, it may take 6 to 8 weeks from the approval for it to credit to the account. If a citizen has an immediate need, when they apply or they call us, we're going to let them know or ask them, do you need to apply for the SIP program because they have an immediate need? The SIP program is the program that we authorize benefits within 48 hours. So even if the citizen, say, applied for LEAP, the 6 to 8 week program tomorrow, but say Friday they find out, oh, I got a past due bill, they still can apply for SIP during that 6 to 8 week time period. And yes, we do work with utility companies. Sometimes folks have exhausted both the SIP program and the LEAP program. Then we're going to refer them to different community resources that may have, faith-based organizations, those kinds of things to help with that service. Our utility companies have been amazing to work with and have worked diligently with our citizens. Duke Energy's done some moratorium. PwC has done some of the same kinds of things, especially in this COVID environment. So the answer to that question is yes. The utility companies have been amazing. We work closely with them, but I want to stress that citizens need to apply for the SIP program if they have an immediate need. And they still can apply for LEAP, but if they have an immediate need that need to be resolved within 48 hours, they need to apply for the SIP program.
Okay, thank you.
All right, we have a question from Mr. Paul Johnson with Beasley Media Group. He does not have a microphone, so I'm going to ask the question for him. And this is for Dr. Green. He would like to verify that pre-K through grade 12 teachers and support staff have received their vaccinations and if it's been successful.
Thank you for the question. So last Wednesday, Cumberland County opened along with the rest of the state to have teachers that were in pre-K through 12 settings and childcare settings be eligible to get vaccinated. So we've seen a number of those individuals come out to our vaccine sites or go out to Cape Fear Valley Hospital for those vaccine sites. And so we're pleased that we've been seeing individuals that fall in those categories. We'd like to see more. We know that there are more teachers, more daycare workers, that are more support staff, our cafeteria workers that are, what we have called vaccine hesitancy, that aren't quite sure about getting the vaccine yet. And we strongly encourage you to do that. This is, as we mentioned today, we have now 3 safe and effective vaccines available. So we'd like to see every appointment slot filled with somebody that is eligible to get that vaccine so that we can move our county forward. And the health department can't do it alone. We need you as the individual citizen to go online or call us to schedule that appointment so that we can get needles in arms so we can get our community vaccinated.
All right, thank you. Any last minute follow-up questions? We've got about 5 minutes.
Yes, this is Ray Duffy with Spectrum News. I have a question for Dr. Green. Regarding the 10% number that we're at with the 65 and older, how does that reflect to our community? Are we reaching everybody we need to reach? And then the second question would be, what can we put out to the community to help make it faster for the process at the Crown Auditorium?
So a couple of things, and thanks for the question. One, we want to make sure that people are coming and scheduling an appointment or using our standby lane on Fridays to get vaccinated. We don't want to leave any vaccine on the table at the end of the week. So we need people to show up. And again, if you have an appointment, we want you to either keep that appointment or cancel that appointment so that that appointment is available for somebody else if you're not doing that. And the things that help us move more quickly and efficient, we've got our process down. We can vaccinate you for those that have been out there pretty darn quickly. But we want to make sure that when people come out, that you don't need to bring anything with you to verify your status, as we mentioned. If you that's helpful because it will help us register you a little bit more efficiently. If you don't have one, that is okay. But if you are coming to get vaccinated, there are a couple of things that will turn you around if you are not, and will make you ineligible to get the vaccine. One, if you've had another vaccine in the last 14 days, so if you've had your flu shot or if you've had a shingles shot in the last 14 days, we are going to ask that you come back when you have not, when you're a little bit further out, or if you've had COVID, if you're COVID positive, or if you're under quarantine, we're going to ask that you stay home until you finish your isolation or quarantine period. Or if you have any of those conditions, we're going to ask that you stay home. And those are the things that are going to slow us down a little bit in line because we got to get you out of line. So we want you to get vaccinated. We just want to make sure that you are in your good health status in order to.
All right. Anyone else have any last minute questions for the group?
I do, if you don't mind, Kristen. Thanks. Dr. Green, can you just say, I know there's been some concern kind of on the national level that that cases had been declining, and they may be leveling off or even going up in some areas. Is that a concern for you locally, and what would you say to folks, to continue, to be sure that the cases go down?
That's a great point. So we haven't seen that leveling off yet. For whatever reason in Cumberland County, our declines tend to lag just a little bit behind the state declines. So we are still seeing our numbers continue to drop in Cumberland County. So that's a good thing. But we want to avoid that trend that's happening nationally where those trends are kind of stabilizing and not continuing to decline. So the ways to prevent that are, one, for folks that are eligible to get vaccinated. So if it is your turn to get vaccinated, we want you to do that. And if there is some information we can provide, encourage your family member, your neighbor, your friend, your church member, your coworker to go get vaccinated. So that's the first thing if you're eligible. The second thing is we have to keep wearing our masks. I know it has been almost a year of the mask wearing, but the evidence is strong. The evidence is clear that masks help to slow down the spread of COVID. So we have to keep doing that. Even if you have been vaccinated, we still need you to wear a mask. And then, of course, practicing the social distancing. We've seen some relaxing of those, some of the health measure or some of those protective measures in a slow and steady way. What we don't need you to do yet is to have those really big, large mass gatherings. We're not quite there yet. So we still want to, we've seen positive trends, but we still want to be cautious and make sure that we are following the governor's executive orders very carefully and still wearing your mask and get vaccinated if you are eligible.
All right, thank you. It looks like it's almost 3 o'clock at our hard stop time. If you have any follow-up questions that you want to get to the chairman, county manager, Ms. Jackson, Dr. Green, or Ms. Taylor, just send them my way and we'll get them answered for you. And I will send a packet with the slides as well as a link for you to be able to download the MP4 if you need to use it to rebroadcast. But that's it. Thank you. Thanks for joining us.